So I've been at Texas Children's for 6 years, and pre-COVID, pre-pandemic, we were using sick bay for different reasons. So one particular reason we were using it for historical review. So every single heartbeat, every single blood pressure, every single breath was recorded from our from our GE monitors at the bedside. Actually, we have many, many monitors on these patients with their complexity of and acuity of their care. So then all of that is being recorded on the sickbay platform. And so the terabytes and terabytes of information being recorded, we would go back and review in a historical fashion. So if we had an event, if we had a cardiac arrest, we could look back and see what did that look like before the arrest and how could we then change our practice for that patient in a preventative kind of fashion. So also in a predictability fashion. So research was being done on that recorded sickbay data in that trying to find relative risk and predictability for even some of our most fragile single ventricle patients. Could we predict when they were going to have a deterioration before they had it? And so there was research going on with all of that data, very rich, high fidelity data, down to seconds and half seconds. And so research papers are being done on different events in the ICU historically. We also had, because we're such a spread out unit and such a big hospital, and sometimes when you're off floor, you could actually pull up sick bay off floor and actually do some remote monitoring when you weren't actually in the unit. So some of us had been in the habit of doing that, but not everyone. And so it was familiar to us, but not in and ingrained in our practice. If that makes sense.